Yeah, I think we've gotten into this demand for service model where people feel entitled every time they walk into their office to get another ultrasound, to get another some type of test, whether they need it or not. And there's no value really in that. It doesn't change the way that we take care of patients. It's more of a nice to have for your baby book. If you still have a baby book, it's probably a virtual baby book now. But there's really, you don't change care based on that ultrasound that you're taking care of. So that's probably one of the biggest things that I see on a low risk pregnancy. So a lot of resources get poured into somebody that really doesn't need the resources. And then the resources that happen for somebody that truly is high risk, a lot of times you don't pick up on those patients in the time period that would actually get you in front of the incident. A lot of times it's retrospective and you're trying to chase it. And so to me, that's the clinical part that we can impact. What is the change that the care team and the person that you're providing care to experiences with this model? And you know, we've done probably for the last 15 years focused on efficiency, but somehow in the middle of that we lost the patient. And you know, we measure patient experience, we do all this stuff, but it's like the patient experience has been lost. And I think one of the things when I look at the Wildflower team and how they have developed some tools that help us think about how do we answer questions for patients, how do we help the patient through each of the transition phases, like when you leave the provider's office and you're heading into the hospital for your labor and delivery experience. When you leave the labor and delivery experience and you're moving on into you're going back home and taking care of this new little person that you thought you knew everything about and you don't know anything about. It's like those are difficult transitions for the staff because they've been used to their own little silo and they're not really thinking about the patient in that manner. And having a digitally enabled tool that helps the staff handle those transitions, I think helps them feel a little bit more empowered to do the right thing as well.